All right, you guys, the next thing I'd like to talk about is imbalanced nutrition, less than body requirements. We're going to talk about the signs and symptoms, nursing interventions, and the outcomes. One of the things that we worry about in kids is hypoglycemia due to the stress of the burn. Is the liver affected? If it is, the glycagon stores will be rapidly depleted. Again, we need to assess their vitals when it comes to nutrition. We'll see an increase in them. Again, the body has that increased metabolic demand. Make sure you're looking at your vital signs card here that I handed out on our lab day. And again, don't forget vital sign. The younger the kid, the higher their vitals are, and because they have that increased metabolic demand. And again, the stress of a burn will put even more demand on the metabolic system. Later on, we could see changes to the hair and skin, brittle hair, brittle nails. We could see delayed wound healing if we don't meet their nutritional needs. And we worry about a paralytic ileus with these kids because they will have or could have a decrease in their GI motility. Typically, when kids come in, and again, you guys, we're talking burns bad enough to be hospitalized. Initially, we'll put the NG tube down for gastric decompression due to the burn, and then we leave it in secondary for feeding. Let's see, just trying to follow my notes, bear with me. Okay, some of your nursing interventions would be provide nutrition that has increased caloric intake to meet those increased metabolic demands. We want to make sure their diet is high in protein to prevent tissue breakdown, and that high protein will also promote healing. We want to make sure that they're taking vitamins A and C that facilitates growth and proliferation of the epithelial cells. We want to make sure that they're getting zinc in their diet, again, for wound healing and epithelialization. We could provide supplement feeds. I talked about the NG tube being inserted. Again, first reason, gastric decompression. Second reason would be feeding. We want to try and make meal times as normal as possible. Enteral feeding is the preferred route if at all possible. We would want to make sure that we're doing calorie counts to make sure we're meeting their nutritional needs. And when at all possible, make sure we're including the child in the meal plan. Remember, offering appropriate choices when they exist. Your outcomes would be that the patient has balanced nutrition, no hypoglycemia, no tissue breakdown, and that their wounds are healing. The next area I'll talk about is acute pain related to injury, could be related to dressing changes, could be related to debridement. We'll talk about signs and symptoms, nursing interventions, and outcomes. We talked a little bit about pain and pharmacological management in our lectures the first week of class. But again, don't forget what we're going to see is a change in vital signs. Vital signs go up when our patients are in pain. We could see facial grimacing, guarding, teeth clenching, irritable, restlessness in younger kids, self-report depending on the age. Make sure you know about the different pain scales that we talked about. And your nursing interventions obviously are going to be monitor for pain. And then we would want to administer analgesia or sedation. Fentanyl if we're doing dressing changes, if we're debriding wounds. For analgesia, we typically use morphine with our burn patients. It's the drug of choice. Morphine has an extensive distribution. It is metabolized quickly in our pediatric patients, so think about a continuous infusion or frequent administration. Don't forget with our burn patients, we want to make sure we're doing IV meds. It has a better systemic absorption. Oral, not absorbed due to decreased tissue perfusion. And remember, we talked about how there could be some changes with the GI tract, the decreased mobility. The same with intramuscular and subcutaneous injections, decreased absorption due to the burn injury. And again, as we know, with IM injections, subcutaneous, that could also cause pain on top of the pain they're already having. So we try to do other routes. IV push of morphine would be the best choice if we can. Whatever you're giving, you want to make sure you're monitoring for effectiveness of pain treatment. And if it's not meeting the needs, we make sure we advocate for our patients. Make sure the dose is safe. Make sure you're giving age-appropriate explanations. We talked about all the side effects of pain medications. They're the same as in the adult world. Constipation, safety, respiratory depression. Make sure you guys are checking all of that. Again, administer short-acting anesthetic agents for procedures. I've already talked about that using the fentanyl. And then how do you know that your outcomes are met? Pain is controlled with the lowest amount of pain medication. So we have minimal side effects, but again, we're getting pain control with it. So lots of different things to worry about there, or to not worry about, but to monitor and manage.